The issue at the moment is that men currently are expected to live less than women, and that the ages of both genders live to could easily be changed by our lifestyle choices. When looking at the five dimensions of health, each individual will most likely not be living a life where all the dimensions' needs are fulfilled. Because the dimensions link directly to each other, this means that any negativity can spread from one dimension to the next and then all five. Since this is the case, if one dimension is impacted, for example, being obese which directly impacts the physical dimension, it creates a link that connects to lower self-esteem, impacting the mental dimension, which leads to emotions being more secretive, and then impacting our efforts to maintaining healthy relationships in the social dimension.
So my great grandma is 99 and she's almost 100 in September. So what we've realized is that there's a lot of care and attention needed as you get older. She doesn't stay in a nursing home, she stays with a family member. However, there is a nurse that stays overnight 24 hours with her, as that is what she needs in order to live a longer life, as she's survived 99 years. So that's her lifestyle. Her diet is also just like carbs, and there has to be a bit of sugar because she doesn't. I believe that she has diabetes, and she uses insulin. However, if not enough sugar is in the body, the insulin brings down the sugar levels, so that it is possible that if that ratio is not maintained, she could go into a coma. But so that's what we have done in order to help her live to 99 years. Hopefully she'll make it to 100.
In order to live to 100 years and increase the average life expectancy of an Australian male, we must not smoke, not drink too much alcohol, exercise more, and eat enough fruits and veggies. A recent case study was conducted in 2013, which exemplified that people can gain up to or more than 12 years with minimal effort by following these simple things, which leads us to believe that many more years can be added if the program is followed too closely.
There are plenty of protective factors which promote healthy living and can prolong your life, but there are also a number of risk factors which should be avoided to minimize damage to your health. Some protective factors which can help prolong your life are breathing clean air, having a healthy BMI by not being obese or malnourished, getting at least 30 minutes of exercise a day, being vaccinated, having close relationships, being socially active within the community with everybody, drinking lots of water. Some risk factors which should be avoided are unhealthy eating, smoking, excessive alcohol consumption, being antisocial, not doing any exercise, or being hydrated. Here are some facts and statistics about health. Social interactions and close relationships are the most important factors in improving life expectancy. Women have a higher life expectancy because apparently they are more likely to engage in face-to-face social interactions. Here are some graphs about the life expectancy in Australia.
The most important part of a plan is eating well. 80% of your physical health comes from your food and habits. A recent study has shown that 4 bad behaviors, smoking, drinking too much alcohol, not exercising, and not eating enough fruits and veggies can decrease your life expectancy by 12 years. As humans, we need to try and turn our bad habits into good ones. We need to exercise more, eat more vegetables and fruits because they're filled with fiber and vitamins, which can lower your risk of heart disease by 76%. A study in 2008 found that regular high-intensity exercises such as running can add up to 4 years to your life. Even a 30-minute walk a day can lower your risk of a heart problem. As a general goal, aim for at least 30 minutes to 60 minutes of physical activity a day. This can make you feel happy and take your mind off the negative things. Lacking physical health can affect your mental health because in society, men and women are portrayed as having good bodies through social media, advertisements, etc. People can be judged for not having these types of bodies, which can cause mental health issues such as anxiety, depression, and just being insecure about their body. Other factors that can cause mental health issues is the people you hang out with. If you are being forced to do something, for example drinking, you can be bullied and targeted for not participating and following their actions. Mental health issues such as depression and anxiety can lower someone's life expectancy by at least 7 to 11 years. Alcohol and drug abuse can lower someone's life expectancy by at least 9 to 24 years.
Here are some tips in improving your health. Eat a healthy diet rich in whole grains, vegetables, fruits, and substitute healthier monosaturated and polysaturated fats for unhealthy saturated fats and trans fats. Take a daily multivitamin and be sure to get enough calcium and vitamin D. Challenge your mind, keep learning and try new activities. Build a strong social network. Follow preventive care and screening guidelines. Floss, brush, and see a dentist regularly. Ask your doctor if medication can help you control the potential long-term side effects of chronic conditions such as high blood pressure, osteoporosis, or high cholesterol.
To wrap up the video, we have concluded that lifestyles must be changed in order to live longer. We have provided facts and statistics to support this case, shown ways that each dimension can become healthier for an individual, and we have given suggestions to what you should and shouldn't do that will help with this process. If an individual is dedicated to being as healthy as they possibly can in every dimension of their health, then they will be able to increase the years of their life expectancy. The way to do this is to always be positive and open up to everyone around you, and accept suggestions made to help you to continue achieving your goal of living a long, healthy life.